Hello, everybody. Thank you guys for tuning in to our graduate webinar here about our graduate communication disorder programs. I want to introduce myself. My name is Will, and I am the graduate recruiter for Fontbonne Admissions. And I just wanted to get this video out just to help promote our programs and the different options that we might have that could interest you in attending Fontbonne in our communication disorders program. With me, I have Dr. Voss. I'll just let her go ahead and introduce herself.
Hi, I'm Jenna Voss. I'm a teacher of the deaf and the Associate Dean in the College of Education and Allied Health Professions. I'm coming to you live from my minivan this afternoon where I'm multitasking a virtual school packet pickup in my role of mom and professor. But I'm really excited to tell you a little bit about the programs we offer and look forward to connecting with you like synchronously real in life to learn about your professional goals and how Fontbonne might be the right place for that.
Awesome. So we want to thank you for coming today. I know it's a lot of other stuff that you could have been doing. So thank you for giving us your time today. So we have three programs that we're going to talk about today. The first one is going to be our early intervention deaf education program, which actually occurs here in St. Louis on our campus. We also have another Northeast collab program that we have that is also deaf education. And then we'll also talk about our speech language pathology program, which is a very prestigious program as well that we have here on Fontbonne's campus. So if you wouldn't mind, Jenna, if you could start
Yeah,
with the early intervention
you
program and just kind of give them a little overview of what that looks like here at
you you bet. I can talk about that one for a long time. That's my passion project for sure. So we need desperately teachers of the deaf in the world. There is a shortage of that profession. So those are educators who serve children who are deaf and hard of hearing. We have a specialty here at Fontbonne and in St. Louis in supporting specifically children who are deaf and hard of hearing who are learning to listen and talk. And they use hearing aid and cochlear implants and other auditory technology to give them access to sound so that they can learn to listen and talk, and then enter school and attend school with typically developing peers and make relationships with kids and families in their neighborhood. So one way that we really need a subset of teachers of the deaf are those who are prepared to work with the youngest babies and their parents. So you may or may not know that all babies born in the United States should hopefully receive a newborn hearing screening before they leave the hospital. And so right away, at as early as 24 hours old, we know if a child has typically developing hearing or may have some hearing loss or hearing concerns. So once teams of professionals recognize that a child may have a hearing loss, even a newborn baby, they're referred into a system called early intervention, where professionals like teachers of the deaf and speech pathologists work with their families to support language and communication development right away from the beginning, really to prevent any delays or disruptions to their development. So our graduate program in early intervention and deaf education prepares teachers of the deaf who have specialized knowledge and skills to work with the youngest children in a developmental manner and with their parents by supporting the adults and the caregivers in their life and coaching them through all the things they need to know to support their child's development in their regular, routine, everyday lives. So if you come to our early intervention and deaf education program, you can obtain Teacher of the Deaf certification in the state of Missouri and then transfer that to whatever state you might want to work in. But you'll also leave with a really, really strong foundation in supporting listening and spoken language development and family-centered intervention.
Amazing. And so this program, we really hang our hats on this program. It's so amazing what they are able to do and what they have our students go out and be able to do in the classroom, even before you step into a real scenario.
School,
Yeah,
yeah.
you get the ultimate practice with this program. So we're really happy about that. Could you talk about how I know you guys had just hit a big kind of grant opportunity. Could you talk about how students
Yeah.
can be involved in that?
For sure. So we're really proud to have been recipients now of another Office of Special Education Program grant. So that's a branch of our federal government that awards dollars to universities to support personnel preparation. That would be preparing teachers of the deaf. Our newest grant prepares teachers of the deaf alongside speech language pathologists, because we know those two disciplines have to work really closely together to serve and support children and families. So our grant will focus on preparing teachers of the deaf and speech language pathologists with specialized skills in early intervention and family-centered intervention, so they can go on to support children who are deaf and hard of hearing and their families. If you're interested in this grant opportunity, first you would apply and be accepted to either our early intervention and deaf ed program or our speech language pathology program. And then you would go through a secondary small application process where we would select a cohort of grant scholars. The grant scholars, it's really a really special project, but the grant scholars receive tuition remission for a fair number of credit hours. Also, they receive stipends for books or technology so they can complete their graduate program. And they also receive a stipend for professional conference attendance or travel. Someday we'll be traveling again, but for now you can use those funds really to apply and present at national and regional conferences, such as the Early Hearing Detection and Intervention Conference or the A.G. Bell Symposium. This is a huge opportunity for our students while they're still in grad school to mix and mingle with the professionals in the workforce and really expand their professional identity and network that way.
Amazing. So basically, we're just offering more opportunity for you to really not have to stress about the financial side of graduate school. If this is a program you're interested in, we are offering this grant for our students to be able to afford to take some classes with us. So
Absolutely. And we would love, if you're interested in these programs, to tell you more about the details of the grant and get you looped into that process as well.
absolutely. So the next program that we're going to talk about is closely related to this program. And it's a little bit different in its own way, and it's really cool. And the way they learn is through synchronous technology. And I'll let Jenna explain that a little bit further. But the programs are essentially the same, but just kind of giving off a different vibe.
Yeah. Yeah, I like it. It's a different vibe. So again, we have the Masters of Arts in Early Intervention and Deaf Education. So if you know you want a focus on the youngest children and their caregivers, that's the program for you. We also are really proud to offer a pretty innovative program that was created in response to another need. So many teachers of the deaf serve children who are deaf and hard of hearing in mainstream school settings. What that means is kids who perhaps received early intervention and have been learning listening and spoken language and are now attending their neighborhood schools for elementary, middle, and even high school, they still need support from a teacher of the deaf and a specialized team of professionals. But they're attending schools in what we call inclusive settings. So there's all kinds of learners, and they might be going to classes with all kinds of different peers. So we have a program that prepares teachers of the deaf with a specialty in that inclusive educational setting. Those teachers really need to anticipate the learning needs that a child might face when they're attending school in classrooms of 20, 25, 30 kids, or nowadays virtually, right? So there's all kinds of advocacy skills and pre-teaching and supportive strategies that those teachers of the deaf can provide kids in inclusive settings. So our Northeast program, it's a Master's of Arts in Deaf Education with a focus in the Northeast part of the United States. We enroll cohorts of students in cities like New York, New Jersey, Boston, Northampton, Massachusetts, Pennsylvania. And those students live in those cities, attend all of their classes synchronously using technology like Zoom. To be taught by an instructor either in St. Louis from Fontbonne's main primary campus, or a Fontbonne instructor who lives in the Northeast part of the US. And then those students complete their field experience and practicum at public and private schools that are part of our partnership in the Northeast region. This is really important because so many times where students do their field experience or their practicum ends up being where they have established relationships and then go on to get hired. So these schools that partner with our university want our students to do their pre-professional work in their schools and programs, and then they can get hired right into those positions and those jobs. So it really allows folks to live in the region where they want to work, yet still receive the excellent Fontbonne preparation and degree, from our main primary programs.
Awesome. So basically just a very, very innovative program that they were able to come up with to allow students to be a part of Fontbonne, but be in those different areas and kind of give help in those other need spaces. So
Yeah.
really awesome.
Yeah.
Uh,
And you know what? I'm going to brag for a second because my peer faculty who were the innovators of that program started that even before it was like everyone on earth was using Zoom. We were using this technology, and so our faculty are really experienced in teaching through Zoom. So when we hear all about all these people needing to pivot in the last 6 and 8 months to use this kind of technology, we feel pretty confident that we've worked out some kinks and have been able to lead the way both at our university and beyond with students who have successfully been attending their classes using synchronous technology for many years.
Amazing. And so kind of going back to the grant for this program, uh,
That's funded too.
awesome, amazing. See, you just covered either way you go, you're going to be covered. So
Yep.
could you explain how that works with this program? Is it similar? Is it the same process? How
It's
does it work?
very similar, yeah. So, again, like I'm sounding so braggy right now, but Fontbonne has received more than $8.2 million from these federal Office of Special Education personnel prep grants. So the program in the Northeast is also funded by one of those. They're still enrolling cohorts of scholars. They will be looking for both teachers of the deaf and speech language pathologists. There's one slightly difference there, right? Because it's a Northeast program. Our speech language pathology students in that program will still reside in St. Louis and do some practicum in St. Louis and do some practicum through teleintervention in the Northeast. We have plans to have our cohort from St. Louis, our SLP cohort in St. Louis, travel to the Northeast and do some partnerships that way. So you could be a speech language pathologist on the Northeast grant. You would just live in St. Louis, whereas the teachers of the deaf students in the Northeast live in the Northeast. Either way, you still apply to the degree program, and then you will interview and fill out a supplementary application for the grant because we pick cohorts. And so we really want to find a good match of a cohort, both in which city they're going to live in and in a balance of disciplines.
Okay, great. So that's a great segue into our last program, which is the SLP program or our speech language pathology program. And I know this one could probably be a little wordy, but if you hello, oh, lost you for a second.
Sorry,
Um,
still here.
so if you want to kind of explain the SLP program and kind of what we offer for those students, a very competitive program on campus, and so a lot of students um, really want to try out for this program or really apply for this program. So I guess if you can speak to
Yeah.
what gives students the best chance.
Yeah, so we're really proud of our speech language pathology program, and I've been talking about the speech pathology students who do a deaf emphasis focus in either our early intervention or deaf or Northeast inclusive grant opportunities. But the speech language pathology program at Fontbonne enrolls between 30 and 40 scholars a year. It's very competitive. There's, more than 300 or 350 who generally apply for those spots. So we're looking for a committed, high quality caliber student who wants the values and the small, really personal, connected experience that our sort of boutique SLP program has to offer. You can do the general track, and speech language pathology students have to be accredited. They experience birth to death, right, is their scope of practice. So our students do practicum, clinical experience, both in our on-campus community-facing clinic or in a myriad of placements, both in St. Louis and around the country, hospitals, schools, private nonprofits, all kinds of ways you can imagine. Um, you can choose, if you're in our speech language pathology program, to do some specialty tracks, because we have faculty who have some pretty special expertise. So one really popular is our adult neuro track. So these scholars, this is outside of my realm of expertise for sure, but these scholars often are working with clients or patients who've experienced stroke or traumatic brain injury and have an aphasia. We have an aphasia group therapy program. We've done some really cool, innovative, an aphasia cruise, where a lot of our clients and their therapists go for this intensive sort of camp experience. We have worked with an aphasia choir, so patients who are learning to overcome the challenges and then do that through music and singing. We have some gardening programs. So just really all kinds of innovation there on the adult neuro track. We also have a deaf emphasis track that I keep talking about. And if you choose that track, you can apply for one of our 2 grant projects, either the early intervention focus or the inclusive education focus. And then you also could not choose one of those tracks. We have other funding opportunities that are linked to this, like graduate assistantships and others. So it's a very competitive program. Our grads come out very well prepared and take jobs in all kinds of scope of practice. I also think I get to announce, like, I feel like I'm letting a secret out, but we've just recently been able to confirm that we're going to offer, coming in fall of 2021, a cohort of Fontbonne students in the Kansas City area in our speech language pathology program. So more details on that to come, but it is very exciting. So you can apply to our St. Louis-based program, or you can apply to our Kansas City, Missouri-based program. It's just on the other side of the state, but we are really excited that that will just broaden geographically and open up more spots in our speech language pathology program. So stay tuned for more details there.
Absolutely. So as you guys can see, these 3 programs are very closely related, so much so that you can choose a track in each one that would probably trail you to the other program. So I have a few FAQs for you, just 2, I think, actually. Um,
Great.
so my first, I guess, frequently asked question, the question that I get the most is, how long does it take to usually complete these programs?
Yeah, I would say the best, shortest answer, since I'm pretty wordy, is 2 years. So
Okay.
most all of our graduate programs, certainly our speech path, is a 2 academic years. Our deaf ed programs, sometimes, depending on what certifications folks hold, sometimes they can be done in a little less than that time, but I'd say 2 years is the right answer there.
Okay, perfect.
Mhm.
And so that's pretty typical across all graduate programs. If you are staying on track and really on top of your work, you can usually complete all of your graduate programs within 2.5 years. So awesome.
Yeah, I was just going to add, like, as a faculty advisor and knowing full well, we are really proud in our department, in the communication disorders and deaf ed department, of the really close faculty advising. So not everyone experienced that at the undergrad level. Advising looks a lot different a lot of places, but when you're in our grad programs, your faculty, like I advise the early intervention students, you are meeting with your faculty advisor. They know the curriculum very well. We track closely. So certainly if you're on grant, it's a cohort model and pretty clear what your path is, but there's not a lot of guessing. So we keep students on track with the 2-year thing for sure.
Great. So my next question, or I guess my final question for you, is: are these programs? We already know one is Synchronous technology, but are any of these programs have any online features? A lot of students are interested nowadays in attending classes online. If not, what are the benefits of having a cohort that actually meets and attends class in person?
Yeah. So, I think if you asked me this question a year ago, I might have emphasized more our on-campus, in-person connectedness. But I think we have all learned through this, like, the power of technology and how connected we can be, even if we're doing that through a screen. I'm looking at what a poor connection I have today with, like, this big sunshine bar across my face. I look like I'm a floating head. But I will say that, can you still hear me? Sorry, I glitched again.
Yeah.
Uh, I will say that primarily, our speech language pathology program is most certainly an in-person program. We have an on-campus clinic, and so our students come to campus and do their initial placement really with our clients on campus. There's a bustling student workroom and a big resource library that students are using. And so I think so much of the connectedness and the high impact support that comes from being in a strong cohort comes from being in proximity to each other. That is to say, for our Northeast program that is built entirely synchronously, and also for our EIDE program that's pretty flexible and taps into some of those synchronous features, our faculty work really hard to create the kind of opportunities to establish relationships. So you're not like in a random online class where you don't know your instructor and you don't know your peers. We do intentional relationship building because we know our grad students persist and do better in our program when they're connected with each other. So while you may have synchronous instruction using Zoom, which has been really flexible when we have to be socially distant, there's also plenty of opportunity to be in person, both in your field experience and practicum and in other ways with your peers.
Yeah, I think you answered it pretty well there. And for students that may be wondering um, what the difference is, there's not much of a difference between being synchronous and fully online. You'll get to experience, like she said, both of the feeling of being in a cohort and still having that flexibility in your schedule. So,
Yeah, I'll say, well, it's not like a totally independent, self-paced online program where you can log on at 2 a.m. and complete your discussion thread. You know, we really, if you're in a synchronous course, you're still logging on at the time that the class starts. There might be breaks. You might still use discussion threads, but there's a live real-time interaction as if we're FaceTiming or we are on Zoom. So we know that it's not just sit and get at a screen. Our programs really emphasize these high impact experiences that are often like case studies and simulations and role playing. And so our students are actively engaged in making connections between their clinical practice and their academics throughout our graduate programs.
awesome. Well, I think that wraps up our programs for our graduate communication disorders. Um,
Awesome.
where could our students reach you or our potential students reach you for questions?
Yeah. Okay. So most of the time, I'm not conducting business from my minivan. So you can find me on campus. If anyone wants to come see the campus, we would love to show you that when we can safely do that. In the meantime, we'll give you a virtual tour. So you can reach me either by phone, and I can just say the number, which is 314-719-8039, or by email, which is J, like my first name, Jenna Voss, V like Victor, OSS at fontbonne.edu. And I will gladly be the connector to hook you up with if you need to talk to the speech language pathology faculty, or if you're interested in the Northeast program, I'll make that introduction and connection. Please just reach out. This like non-interactive piece is not my jam, so I'd really much rather let the prospect tell me what they want to get out of our program, and I'll do a little matchmaking to see how we might be a good fit.
Perfect. So I think that wraps everything up on our end.
Thank
On
you, Will.
Thank you for giving me your time